As you all know, they say health is wealth. We try as much as possible to educate you on basic and certain things you should pay attention to. Come on, it's when you're alive you can achieve everything. So try as much as possible to take care of yourself. Today's topic is about importance of regular medical checkup. A lot of us are guilty of doing this. I'm number one on the list. I'm very, very guilty when it comes to visiting the hospital and trying to find out what's wrong with my body system. But hey, we need to do this on a regular it is very, very important that you check your vital organs. Try as much as possible to know your blood sugar, your high blood pressure, your pressure level, and a whole lot of things, so that you can be able to regulate what you eat, more exercises, and how to do certain daily routines as a human being. So like I said, we'll be looking at the importance of regular medical checkup right here on the Daily Show on health tips. And because we don't know it all, we decided to visit a medical doctor in person of Dr Salisu Ibrahim Kwaifa. He is the consultant physician and nephrologist Wuse District Hospital, and he's here to educate us on the importance of regular medical checkup, why it's very important to undergo regular medical checkup. Let's take a look.
Regular medical checkup is a routine medical checkup that you do to an individual who are apparently healthy or looking well. This test comprises of complete blood count check, checking for fasting blood sugar to rule out diabetes, checking for kidney function test, checking for liver function test, checking for thyroid function test, checking for hepatitis C virus infection as well as hepatitis B viral infection and HIV screening. Then someone has to cap it with general physical exam to identify those who are hypertensive and also those who have increased body weight or obesity. So this, in summary, what comprises of general routine medical exam. Then depending on the outcome of this test, then further tests could be ordered to identify specific illnesses identified during the routine medical exam. So everybody in this context, we are all apparently healthy until those that are screened to rule out chronic kidney diseases, liver disease, thyroid disease, diabetes, hypertension, because most of these diseases, they don't have symptoms unless when they are advanced. So you catch it earlier, it's better for appropriate management and treatment. At least once a year, once in 12 months. But depending on what is obtained, you can do twice a year. That's twice a year after 6 months. Especially if you have hepatitis B viral infection. So we need to be checking your liver health at least 6 months. But otherwise, usually you do it once a year. It suffices. The importance of regular medical checkup is number one. It will afford the doctors or the physician opportunity to identify early diseases so that they can be treated. Those that can be cured. Two, it offers the opportunity for a good follow-up. There are some diseases, even if they are cured, you need to do some follow-up to ensure that they don't resurface or relapses. So without checkup, you won't be able to do all these things. Then there are some diseases that once identified, they are not curable. Treatment is for life. So therefore, you need regular medical follow-up, treatment, and evaluations. Because even if the treatments are given, at times, this treatment may not be optimal in terms of controlling the diseases. So at times, they have to be increased or you can develop side effect from these drugs. So this drug needs to be changed and substituted with other medications. So therefore, without proper medical examination or investigation or checkup, all these things cannot be, done efficiently and effectively. Now, my advice is every adult, 18 years and above, you should endeavor at least to check his general well-being for at least once in a year. Let me give you an example. There is an increasing incidence of chronic kidney diseases or renal failure. So these diseases, most of them can be prevented if there is proper screening. So what I advise, everybody should know his box. Box is BUCS. B stands for blood pressure. U stands for urine examination. In urine, you see the detected signs of kidney disease as well as other infections that you can pick from the urine. Then C stands for serum creatinine. Creatinine is indirect marker for kidney disease that you can see through blood tests. S stands for sugar, blood sugar level. So these are the tests that you can be able to identify diabetes. So if you can identify high blood pressure, diabetes, then if you can manage them properly, then you are going to reduce the incidence of chronic kidney disease or renal failure or kidney failure, because these two diseases are important diseases in causing kidney failure in an environment: high blood pressure and diabetes. Then how do you know somebody is having chronic kidney disease or renal failure? It's by checking his urine, checking his blood pressure, checking his sugar level, and checking for kidney function. So these are the ways in which we can curtail the incidence or the prevalence of chronic kidney disease. Then if you do liver function test and hepatitis B surface antigen test, hepatitis C, you'll be able to know people that are infected with chronic hepatitis B infection, and you follow them up. It's not everybody that is having hepatitis C surface antigen that is having the disease. Some are just carriers. 95% of people infected with hepatitis B, if they get cured, the body takes care of itself. They don't need any treatment. Only 5% will progress to be a chronic carrier. Carrier means you are going to be a carrier, nothing, but you can give the disease to somebody, but you are fine. Out of that 5% that don't carrier, 90% of them will still remain carrier till they die. Only 5%, 10% of that carrier will develop liver cirrhosis and liver cancer. So you can see the value of investigations. So when you investigate patients, you know those at risk, you'll be following them up so that to identify whatever changes in the system. So that if somebody develops liver cancer, if you can get it very small, 3 centimeters, 5 centimeters, you can go and take it out. Maybe it should be fine, cured. But by things more than 5 centimeters, not easy been done. Maybe you have to, even if you do liver transplant, it's just palliation. Palliation means it's not curable. You are just managing to prolong life, but it's not cure. But if it's very small, you can cure it, so to say. You understand? So the same kidney disease. If you find that somebody is having kidney disease at early stage, you can halt it, you can stop, or you arrest the progression. You understand? You arrest the progression instead of allowing it to progress to the level that nothing is being done. No matter if it's more than stage 3, whatever you do, you can only delay it a bit, but somebody is going to reach kidney failure, and that means he has to do kidney transplant or he has to continue doing dialysis. And kidney transplant is very, very expensive. Privately you spend about 8 to 10 million. Under public institutions, you spend about 3.5 million for the transplant, then for the drugs every year between 600 to 1 million per year. So you can see this is capital intensive. Even in the US, they cannot manage it, because kidney disease alone in the US consumes 35 billion of their budget. Just kidney disease alone. So if you compare it to us here, and that's why we see it here every day. Every day is so common, and it's a major killer. It kills more than HIV. It kills more than tuberculosis. It kills more than malaria. It kills more than cancer. Well, kidney disease give you just weeks. If you don't do dialysis or you don't do transplant, you are dying. While cancer can give you some months, some can give you some months, some years. While HIV can give you plenty of time and years. But this disease, they kill within weeks. Patient is gone. So the only way we can identify them is by doing routine medical check.